how has been the medical devices regulations been different from the pharma regulations that we see?
Well, they are evolving. We do have the separate medical device rules, separate from drugs now. So, a beginning of the parting has taken place. We are waiting for the separate law and the separate regulatory framework to take place. The big change that you will notice now in the regulations for devices as an experiment for central government, which they may want to replicate also for pharma going forward, are in two aspects mainly. One is that the inspection for the factories is primarily going to be done through third-party certification audits. So that's going to be done by professional auditors who understand quality management systems and have more knowledge of the medical devices domain. They're from engineering or scientific background. They're not necessarily maybe pharmacists, which is required in the case of drugs.
Okay.
The second major change, which is going to be already ongoing in the case of devices, is got regulatory controls which are proportionate to risk. So the higher the risk, the higher the controls. Lower the risk, lower the controls. Another area which is being done differently for devices is that there's a centralized portal on which manufacturers have to register and get the manufacturing license. And then the state governments come into play. So there's a control of the information and data management by central government as the key driver, whereas in the drug system, it's completely decentralized, and DCGI and CDSO has got no clarity or clue for a particular drug, how many manufacturers are there, where they are located. So there's no comprehensive singular database. This is the start which is happening in devices. And this weekend, there's a Chintan Shivar going on at Hyderabad also, where the minister and the drug regulators from all India, state bodies are going to be electing, are going to be discussing. And I think the merits of what has been happening in devices may be taken forward also for the drug industry.
Right. So we have been seeing an increasing import of medical devices despite the PLI schemes and the medtech parks. How do you think this is going to grow the problem over more? And what are the measures that need to be taken to address the problem of, not the problem, but the increasing import of devices?
Yes, so definitely what we noticed is that post-COVID, the imports have come down for many of the COVID critical medical devices. Not all, but quite a few of them. At the same time, there's been a steep increase of the import of the non-COVID devices. There have been many cases where the imports have gone up from 25% to 152%, which is extremely alarming. And the government needs to seriously consider tariff and non-tariff barriers to address this particular issue as a tit-for-tat policy. Otherwise, we'll always be 80% import dependent. We've seen the gains done in the toy industry using non-tariff barriers. We've seen the gains done in the mobile phone industry and consumer electronics by using tariff barriers. A mix of both, I would say, are required in the case of medical devices. Our factories are inspected by audited by the Indian certification bodies. There is no Indian regulator or certification body doing audits or inspection of the companies in China or other countries. That is not a level playing field. We need a level playing field.
Okay. So, what are the challenges you've seen the manufacturers facing in testing facilities?
So, testing is a big issue because for showing conformity to standards or compliance to the law, especially for the high-risk devices, it's very critical to have access to good quality testing. Now, many of the testing labs which have been put up by CDSCO, they are in the list over there, but they don't have a clue as to why they've been put onto the list.
Right.
There's no clear circular from the government, no clear mandate defined to them that they have to help the manufacturers and they have to do testing and for what. So manufacturers, when they go over there, they find that they don't have access. They find that they are not allowed to get their product tested. And number three, sometimes they don't have the capacity and capabilities. Many private labs do exist, but those private labs have not got empaneled. And they do not know how to go around the impaneling process. So there are gaps over there which need to be bridged very rapidly. And we hope that the Department of Pharmaceuticals will come forward and do a funding and bridging support exercise like it was done in the case of the food and agriculture industry for the food processing and for the testing under FSSAI.
So recently there has been focus on the training on medical devices. How important do you think this is?
So that of course is very important. Any manufacturer who is selling the product has the onus that the users, whether through a paper IFU as a silent salesman or through electronic IFU, or through an animation movie, or through actual physical face-to-face training, uh, either directly or through CME, provides the education and training as to how the medical device needs to be appropriately handled and used. A lot of medical devices do require knowledge and skilling. Like you've got different mobile phones. Whether you use a Samsung or an Apple phone, it takes you some time to change over.
That's right.
There's nothing wrong with the product. It's nothing to do with quality. It's a question of change of habit for the user.
Yes.
So in that respect, that familiarization and change what a brand is offering needs to be fully appreciated by the user. Otherwise, you'll have issues and you'll have accidents, but then you can't blame the product.
So my last question will be, how do you see the Indian medical device industry growing in the next 5 years?
Oh, I think there's a very optimistic hope from all of us. The market size currently is at about $20 billion. We think it will go up double to $40 to $50 billion in the next 5 years' time. That's a market space. Current market share for Indian companies is hardly 20%. There's a medical device policy in the offing. The parliament has made stupendous recommendations to the government. If at least 70% of those recommendations made by the parliament are enacted by the government, things like a separate law, a separate department, a review of the tariff, a review of the price control mechanisms, trade margin rationalization, research-linked incentives, broad-basing the PLI scheme. A lot of recommendations are given over there. If those are acted upon, there's no reason why India cannot have a 60% market share of that $40 to $50 billion market. And just why stop at the Indian market? We can be a major supplier in the world. Now, there's a huge need for supply chain diversity. Every exhibition we participate worldwide, we have people coming to us using this keyword, supply chain diversity. They don't want to be banking upon, like in the past, just on one country. And India comes as the second natural choice for them. If you don't step forward, then they'll go to the third country or fourth country. We cannot miss the chance. We can't miss the bus.
Thank you so much, sir.